So, a question I get asked all the time is how to decide what certification to do, whether they should do a clinical, postgraduate, master's, or whether they should lean into something else more specific, and what would be the best for their career projection. And people generally are asking this question early on in their career because they feel like that if they do the wrong one, it's somehow going to impact them in a negative way. At the end of the day, the answer to that question is to do what interests you most. So I went and did a master's in emergency nursing and trauma because that's what really filled my cup at the time. Now, if my career had taken a turn, and it did, into management, leadership, education particularly, then that means I just do another one or change my direction or do professional development to help build the skills that I want. There's never really a wrong answer. Obviously, if you do a clinical stream, then you're investing in more time in that clinical space. But at the end of the day, there is no wrong choice. If you're educating yourself and growing, it's always a good choice. What advice I would give you is if you are looking at a clinical postgrad, that don't jump into it so early that you've only just finished your graduate year. The reason I say that is not to delay people, educating themselves. It's because some of those postgraduates you'll get more out of if you've got a little bit more clinical experience under your belt. And if you're going to spend the time and money and invest in doing a postgraduate degree or master's, you really want to get the most out of it and don't want to just sail through it to get passes so that you have the bit of paper. Because the whole point of a postgraduate is that you are growing your skill base. And people who have rushed into it, particularly in critical care areas, have found that they're really struggling because they're not at the clinical level that the postgraduate is expecting them to be. For example, if you do an ED one, the expectation is that you can triage, and most emergency departments won't let you triage in the first year that you're there. So it can be difficult. So just take your time and invest in it as much as possible so that you get the most out of it. I know the old saying, P's get degrees, that might be the case, but if you're doing a postgrad, you really want to invest in knowing as much as you can about that specialty. There you go, top tip. Hope that helped.